Episode of the 120 Pod, where we talk about sepsis, chronic illness, and disability, because all three ultimately are related. I am a septic shock survivor. I decided to do this podcast to elevate the voices of survivors, physicians, researchers, everybody, because I love talking and I love learning from other people. And my very special guest today is Dr. Cindy Ho, and she is our Chief Medical Officer with Sepsis Alliance. And back in June, I saw her post a link on LinkedIn to a project that she was currently engaged in. Dr. Ho works tirelessly, not only as a physician, but as, an advocate and researcher. And she's very much into her work. And so this project that she mentioned, I reached out to her and said, hey, we need to talk about this on the podcast because it's not often addressed, and it is very, very important in terms of infection prevention. So as I said, Dr. Cindy Ho is the Chief Medical Officer for Sepsis Alliance and also a member of its board of directors. Dr. Ho specializes as an infectious disease physician, and she's duly board certified in internal medicine and infectious disease. Now, Dr. Ho has much expertise in sepsis, antibiotic stewardship, that's the appropriate use of antibiotics, infection control, quality improvement, patient safety, equity, and language access. Now, at her hospital system, she is the principal investigator for a grant from the Office of Minority Health to reduce inequities in people who speak a language other than English, which is the very reason, back to that LinkedIn post that I saw her make in June, this is the very reason that I invited Dr. Ho to come on the podcast with me today. After all, we are a global society, and we need to have these discussions in order to understand how to communicate better with all members of our society to reduce the harm that can come from sepsis and to help everyone learn how to practice safe infection control. Now, I want to remind everybody, even though I am talking with a physician here today, please do not use this as a substitute for your own medical advice. These podcasts are for information purposes only. If you have an infection or suspect you have sepsis or another medical issue, please contact your own physician or go to your nearest local emergency room. And without further ado, I want to welcome Dr. Ho to the podcast today. Dr. Ho, for being here with me. I've known her for a few years now and interviewed her for several articles that I did before on sepsis. And so I'm very excited to welcome you to the podcast today, Dr. Ho. Thank you for being here.
Thank you, Jackie, for the invitation. And I'm really in high praise of all the things that you do for sepsis and Sepsis Alliance in particular. And I was so nice to meet you in person the other day after years of kind of Zooms and so forth. So thank you for this opportunity.
That was great. I mean, yes, audience members, we met actually last week in person for the first time in New York at the side event for the UN with the Global Sepsis Alliance, and it was great. It was wonderful to meet you. Anyway, so we're going to get right into it. And Dr. Ho, could you tell us a little bit about your background and when you joined the Sepsis Alliance and why?
Sure. Well, I am an infectious disease doctor, and with Sepsis Alliance, I'm the chief medical officer. The connection with Sepsis Alliance starts way back when our community hospital system achieved national acclaim through an award given by the Sepsis Alliance called a National Sepsis Hero Award. That was really our first intersection with Sepsis Alliance. It was very glamorous, glitzy, that is, not glitchy, to go to New York City for this gala and to receive the award along with many of my friends and mentors like Dr. David Condalucci, Marianne Kramer, and more. And that was really the first time that I saw Sepsis Alliance in person. And from there, basically, it was kind of a couple of years that came about. And then I think I may have just kind of outreach to Tom Heyman, who's the president and CEO of Sepsis Alliance, just telling him I just was interested in becoming more engaged, and essentially sent my CV, my background and experiences as an infection doctor. Basically, I treat people with infections and who have sepsis, or in its most severe form, septic shock. And essentially, the the board liked me, and so they invited me, and I started showing up kind of all the time because there were these weekly Sepsis Alliance meetings. And I joke now, but I kind of became an adopted member of the Sepsis Alliance. And so let's see, the award for our hospital was 2016. Then I became an advisory board member around 2019 or so. And then I think it was maybe the year after, 2020, that I became a member of the board of directors, which was really a privilege. And I kind of kept showing up and volunteering and doing things for Sepsis Alliance. And eventually they asked me to become the chief medical officer. And so kind of every single time they asked me to uh, do something for sepsis, I start to try to raise my hand before they finish their sentence, because it's really a great nonprofit. And so, as chief medical officer since 2022, I've been engaged in different aspects when I have the availability. So it's really been a privilege and an honor. I will just say, for those who are not aware, Sepsis Alliance has many websites, but sepsis.org is maybe the easiest one to type in.
It is easy. And, it's short, it's sweet, and it gets you right there. And thank you for mentioning that. You took the words right out of my mouth, actually, there. Because Sepsis Alliance does do, as I've talked about before on this podcast, and I've also had Tom on here, Sepsis Alliance provides everything for free that they give us, like the online support groups and through the Sepsis Alliance Connect program. They also provide resources and training and, all kinds of things. It's a wonderful nonprofit, and, it's just wonderful. And that's actually how we met and we connected, was through there. And now you've been an infectious disease doctor for quite a while, right?
We'll just
Like,
say
was
many
that your
years.
was that your first specialty,
Oh
infectious
yes.
disease?
Well, how it goes is that when you train in the United States, you become a physician, and then you can decide which pathway. So anyone that has a concern or interest in a subspecialty has to go through the main process. And so I went through 3 years of an internal medicine residency program. And in that fashion, you can learn all kinds of different avenues of where you might want to serve patients, whether it's in the outpatient setting, in primary care, or in a certain specialty. And so I essentially decided to take the infectious disease track, which is another kind of 2 years of training. And then since then, I've been in this field. I would say that even though I've specialized in infectious disease, I try to keep my mind and interested in other aspects, such as cancer screening, to have some knowledge of uh, different items like diabetes, high blood pressure, and so forth, because it's important. And we also serve patients who have HIV who may have other medical problems.
Yes, you seem to cover like a wide, diverse area of topics. And, on LinkedIn, I see you posting a lot about all the wonderful things that you're doing. Like you have so much energy, Dr. Ho. You show up, you're everywhere. And I love it. I'm totally here for it.
Yeah, that's, I guess I want to get a little bit of credit. So for myself or my team. And so, yeah, I think it's really good to tell the stories of showing up at different community events, or with other organizations at other venues, like with yourself at the United Nations Side Parallel event, with the Global Sepsis Alliance and other organizations. And it's because we need to tell other people about all these different events, and so they can gain some knowledge about sepsis or any other number of topics. And I think it's important to show the world, let alone kind of my friends on LinkedIn, so to speak.
Yes, it's great, all the things that you do. And infectious disease and infection prevention is part of sepsis prevention, right? I mean, it kind of
Oh,
segues
oh,
into
absolutely.
both.
Absolutely. If I could just simplify it a little bit, there are many technical definitions of sepsis, but at the root of it, sepsis is the common denominator is that you have to have an infection. So it goes without saying, but if you don't have an infection, you can't progress to sepsis, essentially. And it sounds so simple, but the infection prevention space is so critical. In fact, at Sepsis Alliance, we have a phrase that I helped to coin, which is infection prevention is sepsis prevention. And I am just an advocate for trying to prevent the infections from occurring in the first place.
Right. Prevention is the best strategy because once you get to
It
sepsis, then yeah,
It is. There are many things that people can do to prevent infections. One, it's about talking to people like yourself, educating yourself. There's lots of materials on sepsis.org that are in written in a format that could be understood by anyone. And so, if you think about some aspects of preventing infection, it's washing our hands with soap and water. It's about keeping up to date with age appropriate, condition appropriate vaccines. It's about food safety because you hear of sometimes handling of food and sometimes the infections that come about. It could entail other avenues that knowing what is an infection or knowing when to seek care. There are many different aspects of infection prevention, and I find that we just need to kind of keep educating at a baseline and just kind of reaching more pockets of people.
right. And Sepsis Alliance does have a plethora of materials on its website, so many resources on there, and they're easily understandable. Like they've really broken it down nicely for non-MD people like me.
Absolutely. And, I think this is the one of the key aspects of this organization is that people will reach out to Sepsis Alliance. They'll look online and they find that the material is written in a way which is understandable. At the same time, if there are clinicians, whether there are physicians or nursing, there is a ton of kind of medical education level coursework, and we're thrilled now to have not only nursing education credits but also medical education credits. But I recommend it as a resource. It's tempting to tell others, even of any age, to go there.
And they have a podcast now too called I better get this right, Sepsis, the Spectrum, right? The Sepsis Spectrum,
Yes,
I
we're
believe.
thrilled that there's going to be a year two as well. So it's
Yes.
exciting. And so if you haven't caught it, it's a series, and so feel free to hop online.
Mhm. Yes. And again, just easily digestible information for anybody, really. Now, I asked you to be on this podcast because I saw you make a LinkedIn post back in June that really piqued my interest, something that we don't talk a lot about or talk about enough. And so, can you tell us a little bit about what that was and this grant that you pursued? And
Yeah, yeah, sure. I guess I'll talk about it in piecemeal. So, what we're talking about is to provide culturally and linguistically appropriate care. And that sounds like a lot of words, but there's a lot of meaning toward that. And essentially, when we provide linguistically appropriate care, it means we're speaking the same language or trying to accommodate the different language preferences of the patients that we serve. And at the same time, we have to have a cultural awareness if there are any nuances to the people that we are trying to take care of. And so it was actually more than 3 years ago now that our team decided to pursue an opportunity. And I will tell you that for years, like years and years and years and years, it seems, I would apply to grants, and sometimes I'm like, oh, maybe this one is it. This is just like Spidey sense or something, and then it would just be rejection, rejection, and rejection. We know how rejection takes many forms, but they were just
Oh, yeah.
devastating, really. And
Yes.
um, and so my mentor, Dr. David Condalucci, said, one of these days you'll get one and they'll just keep flowing. I was like, okay,
Mhm.
but have faith in in what people with experience have. And so at the time I had been doing quality work in an interim position. And so I intersected with other people who are engaged in patient experience and equity, like Mr. Dwight McBee. And what we decided to do is, let's see what happens if we put together a story, look at some background information, and put together a proposal for uh, this grant, which was from the Office of Minority Health under an initiative which was to promote equitable access in language and language services. And so it was a lot of hard work with many team members, and eventually I was on vacation in Hawaii, but like someone who's hardcore, I was checking my email anyway, not because of looking for any kind of grant information, just because it's the right thing to do. And so I got this email, and I was like, does this mean that we got it? I was actually like not sure at all, not sure. And there's a time difference, and so I was like, okay, I'm just going to email the team and see what they think of this. And I said, and I still was not sure. I was like, do we get this? And then it was like, yes, and so there's this huge kind of virtual celebration, so to speak, of by email. You can just imagine how excited the team was. And so then we went out to sort of preach, so to speak. Um, and and I never thought that I would land into this space of being invested into equity, into the community, and into a term that's called language access, which means many things, but is to ensure that people understand the health information that is provided in the language that they either speak or sign, because we cannot forget about those who use American Sign Language. And it's really opened my mind to a world of many things, as if literally, look at what I've been missing all these years when I sort of buried deep in clinical work, and now kind of going out to the people, like literally to basements of churches and to areas where people live, work, and that's their community. So
Taking it
to
to the people,
Oh,
essentially.
where possible, yes,
Right.
because
Right.
we want to meet people where they are,
Exactly.
and so to to everyone, I would say that it you should consider providing culturally and linguistically appropriate care. It just makes sense. Like, it kind of like, if you provide that sentence, it's like, oh, sure, that makes sense. And so that's the kind of a long journey. It's actually been 3 years since we got that acceptance, and then it's a lot of writing. I have not done this much writing since maybe college. And what it entails are different reports, like literally quarterly progress reports. And our team is very hardcore. We will write, I don't know, 40, 60 pages sometimes. And we just, we're privileged to have what's called a 6 month no cost extension. So that means that we don't get any more money, but we get the time to do more good things for people.
Right. And I'm glad that you mentioned the deaf community and hard of hearing community because I'm on the Frederick County Board of Commission on Disabilities, and one of our board members, our vice president, is deaf, and she is a strong advocate, admirable advocate for always making sure that that community is included. Because I think sometimes when we think of other languages, we leave that one out. And so it's good to hear that you're including that as well.
Absolutely. It is, and I will say that what I've learned along the way sounds so simple, but the truth of the matter is you could speak English and you could speak English your whole life, but what we say may still sound foreign. And and so we have to consider if what we're conveying, particularly if it's health information, needs to be conveyed in a way which is understood. Um, and there are different modalities for this, right? Do we write things down? Do we speak them? Do we say them again? And I use an analogy. I don't know if it's a perfect analogy, but um, though I have my background includes that I am Chinese, but I was born here in the United States. And certainly my English is way better than my Mandarin by leaps and bounds. Um, but, uh, you could have spoken English your whole life and you may not understand medical terms. And another way I equate this with this analogy that I was going to get to is that when I speak to my mechanic, I'm like a deer. They're they're speaking to me in English, and I'm like, um, how much is that? Like, is it like,
I
I,
feel the same.
and so, we laugh, but it's like, that's something more benign like your car. Imagine if it's your health or someone else's health. And so it's really led me down a pathway of essentially thinking twice when I try to speak to someone because I thought I explained it very well, but I may not have. And and it's really opened my eyes to kind of even concepts of health literacy. Um, because that would be terrible if I just saw somebody and they didn't understand what I just said. And we need to be attuned to other things. People comprehend in different ways. Body language is critical. Maybe they're like like this or whatnot. So I think it's all very important.
Yes, and being a keen observer, I think, of those nuances. Well, I think physicians are trained in that as well, aren't they? Like body language and, observing the patient as you're talking to them.
Absolutely, and you raise a very good point because as even as future physicians, future nurses in schools, we should pay attention to um, the environment kind of from the door. How does the patient look? And then up close, how are they as you assess somebody and take a history and exam and look at different objective data and so forth. So these are very instrumental. And in fact, we plan to speak to medical students in the next couple of weeks. We've already engaged with some students, and this is a way of what's called sustainability because all grants after a while they end, but how do you instill in others what you have learned in simplistic ways, but so that the life of the work continues in some fashion?
Right. So you got this grant and to implement this strategy, and I think that is an excellent analogy with the car and the auto mechanics, and they have their own language that they speak, which
Yes,
I also cannot understand. And I think as a uh, English speaker, my primary language is English, but to go into the doctor's office can be very intimidating. That's hard enough to understand the medical terms, even if you are a native English speaker. However, if you're not, or if English is your second language, it's got to be so much harder.
absolutely. And this is why one of the key principles of what we've been trying to convey to folks is that if there's an entity that receives federal dollars, sorry, not daughters, um, the entity is required to provide medical interpreters or medical interpretation for no cost to the patient or and I would say it works both ways, that there are many people out in the community that don't know that. Um, and of course, we have to talk to future generations of students and so forth that this is the expectation that if somebody says that their primary language is Spanish or some other language, it is their right to receive medical interpretation. Now, the medical interpretation can occur in many different ways these days. So, for instance, it is very common to have kind of technology with video remote interpretation. And it
Yes.
could be an interpreter that shows up on a screen and, of course, provides confidentiality. They may be culturally aware of the person's, have some knowledge of the person's cultural background, and, of course, speak in the same language and have been trained in medical interpretation formally. Sometimes it is through audio services, and then other times, depending on where you are in the world, perhaps an in-person interpreter might be available. But it's really important for people to know this, and it's even more important for uh, people to realize while family and friends can be engaged in helping convey the story just like you would bring an English speaking friend or family member to your doctor's visit. It's important that we use a certified medical interpreter for the training they've received, for the non-biased way that they can present everything and more. And so that's kind of a key aspect that we want to convey.
Right. So a medical interpreter naturally would understand the medical terminology and then be able to convey that information to the patient.
Yes, that's correct. And you could very well be very knowledgeable in a particular language, but you might not know how to convey those medical terms. And there certainly have been instances out there of adverse outcomes when family members have interpreted and then it's been sort of misinterpreted. And those are public knowledge in uh, online. And probably one of the most famous cases is of Willie Ramirez, um, who who was who had some tragic outcomes at the end. Um, but there was a word that was used by one of the family members called intoxicado, and it was intended to be a concern for ingestion from food, but it actually was misinterpreted as if maybe the person was intoxicated, such as from alcohol or drugs or whatnot. So there was a pathway that the medical team went upon, and they put this young man on a ventilator for airway support and everything. And then, unfortunately, eventually noticed that there were some changes neurologically. And at that time, they had to send the individual to another hospital system for a very special CAT scan. And unfortunately, there was a brain bleed. And ultimately, this individual suffered from um, becoming a paraplegic. And sort of when folks have looked at the root cause, it's that there was a misinterpretation, perhaps not hinging on just on that one word. There's probably always more to the story, but and while that is the most dramatic example, or one of the most dramatic examples, I think it really conveys to people who are in the public or medical profession that, consider using a medical interpreter.
Right. That way you get it right from both sides, the
That's
language
right.
aspect and the medical terminology aspect.
Absolutely, absolutely. And this is not to remove family or friends from the conversation. It's just that we should not rely on family and friends as a sole source. It would be similar to when you speak to patients and you gather information from a totality of different sources, from the chart, from the backdrop, from many places. And so it's something that I think we should talk about more, essentially.
Yes, and actually the family member being present or the friend can help reinforce the information too, along with the
Abs-
medical interpretation.
Absolutely, and there are certain concepts that I think we can speak about, and one of them is teach back. And it sounds very simple. Okay, yeah, teach back, right? So, but an important concept, and it essentially means that now that I've explained and give you a ton of information, what can you tell me that is the essence of what we want to do now? And I want you to teach it back to me. And this is very common in nursing spheres. We probably should do it more in doctor land, and also to document that teach back was utilized. So that's an example that the person that you just spent all this time talking to, and or even their loved ones, maybe I did not convey it in a way that was understood clearly. If um, they're not able to tell me what to do next, and that's what we want, right? We want people to do the next steps, and so it needs to be conveyed in a way that they understand. So that concept is teach back. Another concept is something called plain language, and that also sounds really simple, but when you go through medical training, you use medical terms, and you. I want to say you become. I don't think it's right to say the word wonky, WONKY, but you get into this, okay, medical language because you've been speaking medical language your whole life, and then
Right.
suddenly in front of live people, perhaps some technical terms need to be still stated, but simplified in a manner that could be understood to to a level where the comments you should receive are, oh, no one's ever explained to me in that way. Oh, you explained it very clearly. And I would say I sometimes get those comments, which is reassuring because sometimes I'm not sure if what was conveyed was understood. And I think this is important for uh, communication at all different levels. And so two very simple concepts of speaking in plain language and using teach back, but these are even items that we could do in our everyday lives, regardless of if we're in the medical field or not.
Exactly. You can use it with children. I mean, really, if you're
Mm.
telling them to do something, then ask them to explain it back to you. I actually think I had an instance recently, well, not too recently with my osteoporosis medication, but 2 years ago when I was given an osteoporosis medication that I had to inject daily. I went to see the nurse, and you're right. I mean, I think in the nursing circles, the teach back is very popular because she showed me how to do it and then gave me the pen, looks like a little EpiPen, and says, now show me what I just showed you. How would you do this? Right from getting the alcohol swab out, cleaning the area, and the injection pen itself and how that works and using the plunger and putting the cap back. I mean, every little step. And I had to demonstrate it back to her. And my pulmonologist did the same thing just recently with a new inhaler because I said, okay, last time I used an inhaler, it was one of those kind of things. And this is like, it looks like a dial pack of some sort or something. It's a round object. The inhaler is itself. I said, how do I use this? And then he demonstrates and then he gives it to me. He says, now you do it. and yeah, I mean, that really does reinforce it, even if you're not a speaker of another language. you know?
Yeah, you know, that's actually also another concept, which in some spheres we call it return demonstration. That,
Yeah.
okay, we talk to you, and then in return, we want you to demonstrate. And demonstrate versus talking points versus doing it can be very different and kind of intimidating because here is a doctor or nurse they just showed you, and but it can be very intimidating when you do things yourself, and it's very important so that you can properly administer the medication to for your condition and more. And there are times that in addition to, of course, the return demonstration, there is the written document, and to ensure that the written document is written in um, very plain language. Sometimes we will say that it's a certain level of education for the way in which the terms and descriptions are written. I think we should also recognize that not everyone's eyesight is okay. So looking at
Yes.
text on a page or text on websites,
Mhm.
kind of even sometimes text on my own slides, are probably too tiny for being able to see. And it's not even a matter of if you have glasses, you have contacts, or anything. It's just about making language and words accessible in different ways. And sometimes I'll joke, oh, I'm going to give you a quiz because, it's tiny and I can, and all of this. But it's important to say that if you are going to give information that is kind of on the tiny side, perhaps that's for reference as you summarize the key points to the audience and more. Um, but I know we're speaking in kind of very simple tidbits, but you would be amazed that once you start to consider different aspects of how the ways in which we thought we were conveying information, perhaps we could do better. And that's my only suggestion.
Right. It's sort of like accessibility. I'm sure you know that as a writer, I've been writing these accessibility guides as an adjunct to tourism websites. And ultimately, I've explained to the tourism professionals that the goal here should be to emphasize how accessibility applies to everybody, really. With people with low vision. Well, for example, the audiobooks, which everybody enjoys now, those were originally created for people who were blind or have low vision. And now here we are. We all like to listen to an audiobook if we're cleaning or, driving somewhere, or, it's so their accessibility does benefit everybody ultimately. It
Yeah,
doesn't
that
even have to be this adjunct off to the side.
yeah, that's really interesting, Jackie. I didn't know that that was the history of audiobooks.
Mhm.
I will tell you that my husband is disabled. He uses a manual wheelchair. And despite that, he is brilliant. I'm not just saying that because he's my husband, but imagine the complexities of growing up disabled and achieving great heights, like going to MIT and all of this. Nevertheless, when we travel, we need to consider certain things that people take for granted. I'll give you one example. Going to some places you could rent out a home, and oh, that's so nice. You have so many rooms, but actually, we don't know if the home is really wheelchair accessible in a way where, do you count the steps before you enter a hotel room? Do you look at the size of a bathroom? Do you look at if a wheelchair can go through into the entryway, into the hallway? Is the room even close to an elevator? And I'll give you one pet peeve that I think he has, which is that inside a bathroom, if there is a tub, in a handicapped accessible room, no less, you'd be surprised how many times that the soap, the shampoo, and the conditioner is attached, but like super high. Like, kind of, if you were to stand, oh, sure, it'd be at your standing level. But if you're to sit down in the tub, or even if you were to have an accessible chair, most people probably couldn't still reach it. And so these are things that I consider that most people never even think about, most likely. And you could keep looking your whole life at different ways to make people's lives better, but I think the important thing is that um, though we think of people who may have physical handicaps, as we age, we will have less mobility, less flexibility, and so adaptability is important to everyone, regardless of seen and unseen disabilities.
Exactly. Yes, mobility challenges, loss of hearing and loss of vision and all of that. Eventually everybody is headed down that path. And so that's why it's very, very important. And I understand that pet peeve about the shower and the conditioner and shampoo being up so high. And the bathrooms, when I did use a wheelchair a few years back, the bathrooms were my big pet peeve. The way the doors were configured, it was accessible, yes, but you couldn't wheel in, you couldn't transfer, you couldn't get the door closed. It was not engineered properly, not at all. So, that's why I think when I do write these pieces for tourism and I go and check out some places and I look at those bathrooms, I'm like obsessed to make sure, is it a nice big space? Can you turn around? Can you transfer in there? But back to the issue of the talkback methods, but the plain language. I'm blessed with many doctors, many very good doctors. I have a lot of specialists. My gastroenterologist especially is like naturally inclined to use a lot of plain language because gastroenterology can be very cumbersome. And one time I did have, after my septic shock crisis, and I had all that bowel surgery done, and about a year later, I had a partial blockage. And I remember later, after all the alarm had passed and the blockage had cleared, and he explained it to me as like we live here in Maryland, so we have Interstate 95, which actually runs all up and down our coast. And he said, it's like a backup, Jackie, it's like when you're backed up on 95 and traffic is stopped. He said, and then he warned me, he said, now be prepared because you know what happens when the traffic clears on 95. Everybody guns it going 200 miles an hour. And I immediately got the message. I knew what he was telling me. But he rarely uses like medical terms. He keeps everything basic. And then, of course, those colorful analogies that he likes to use. But it helps me understand.
Yeah, I mean that's a great example. Because once you start to talk above somebody, like, not sure if we're getting it. Um, I would say that what I try to do is a mishmash of the medical term and then to explain the medical term. Um, and these days, of course, people can sometimes have access to patient portals and to see what was written in the notes and so forth. But sometimes I think it's nice to have said some medical terms, kind of depending on the situation, of course. But um, because sometimes things can be overwhelming, and so it's deserving to repeat information on subsequent days to sort of summarize in case certain terms were could be discussed differently and so forth, and certainly to give these examples of analogies and so forth is really, really helpful.
That like reinforces it for me. So
Absolutely, absolutely.
I get the picture. And I think it's so important. Again, what you're doing with this, what you've done, getting this grant and what you're doing in making the medical terminology and everything accessible to everyone. There's probably no other time where we feel most vulnerable than when we're in the doctor's office or when we're lying on that gurney in the emergency room, listening to the doctors and trying to figure out what's going on. And it's terrifying. It was terrifying. It's terrifying to me as, again, as a speaker of the English language. But if English wasn't my first language, I try to imagine how much more frightening that is, especially when you're most vulnerable.
Yeah, I mean, it is very, very scary to be a patient in any setting. Of course, most people just want to stay home and not have to see a clinician in the office setting or in the hospital setting. And and this is why sometimes people will bring an advocate, whether it's a family or friend, and more. Um, but absolutely, if one speaks English, that's helpful, I'm sure, but also to convey information in a way that could be understood, and let alone if somebody does not speak English. There's actually a story of an actress, Ashley Park, I believe is her name. Obviously, she speaks
From
English,
that
and
show, Emily in Paris.
yes, yes, yes. I've
Yes,
actually never seen that show just yet, but I do recall that I believe that she unfortunately had sepsis in another country and then
yes.
was able to get a team of people that could interpret for her. And then I think of course she had a loved one that was helping her along the way, but it was sort of like the tables are turned. Here, the actress uh, did not have the proficiency of the language of the country that she was in, and so we talk of the term limited English proficiency, also known as LEP, which means exactly that you may not completely understand, read, or write um, in English. You may have some level of command, but if we go to a different country, we could have, for instance, limited French proficiency or something like that. And imagine if the tables are turned and you're hospitalized there, how scary that could be. Um, and the relief when somebody provides an interpreter in your language. Imagine if the tables are turned, but we don't want the tables to be turned. We want people to recognize the importance of conveying language. There's another phrase, it's called language concordance. Um, so naturally, if you had somebody who was proficient in Spanish and they're taking care of someone who's in Spanish, that's a true language concordant. But the way the rest of us can provide language concordant care is to have a certified medical interpreter to speak the language of the person to the patient in the language that they understand, and keeping in mind that sometimes it is American Sign Language and or other kinds of languages.
I think you bringing up Ashley Part 2 brings up a very important point that sepsis is a global issue. Infection is a global issue. I mean, it's not just a United States thing. It's not just something that happens here in this country. Sepsis happens everywhere, and it's really devastating in some countries. And so, yeah, likewise, I mean, I could be in another country and have an infection and not understand the language. And so it's really something I think that can be a great unifier in figuring out globally how we get, like, how can this, or how have you used this in terms of infectious disease and infection prevention with communities of people, other, communities that don't speak English or need American Sign Language? How does this tie in with infection prevention and teaching and sepsis, and therefore sepsis prevention?
Yeah, I will say I have not personally reached out to American Sign Language communities just yet, but we're working on it. We have spoken to different communities about infection prevention, sometimes about sepsis. Sometimes we don't get there quite yet because we have other information to convey. Um, but on a global level, we know that many people suffer from sepsis, and many always it starts from an infection. So on a global basis, it is critical for infection prevention is sepsis prevention. And some things on a global level we take for granted, like running water, like soap. And so in the United States, we know that hand hygiene amongst healthcare workers could be a lot better. Um, and it makes me want to, and I sometimes do tell groups of people, listen, you have running water and soap and water, you have stations, you have electronic this or that. And imagine if you tried to use hand hygiene, but you didn't have running water or is not as accessible. And this is why, places like the World Health Organization have a very good infographic about uh, infection prevention, specifically regards to sepsis. They talk about different components about everyone's role, which is to prevent infections, and then try to prevent progression of the infection to getting into a severe stage of septic uh, complications and so forth. And I'm sorry, Jackie, can you relate to me the root base of your question? I know I got distracted with the
Yes.
global aspect.
Yes, I know. I'm sorry, I rambled there a little bit. But so how does
Oh, I
providing
remember.
culturally
Yes,
appropriate care, yeah, how does it tie in with infection prevention to therefore
yeah,
then
yeah,
prevent
yeah. Now I remember.
sepsis?
Yeah, and so that's right. Even though I speak some Mandarin, it's certainly not fluent. And so when we go to communities where there's different languages, whether they're Asian or whatnot, we will provide a certified interpreter. So I'll speak in English, and then we have a slide in English, and then the slide becomes in the language of the person in the next and there is an in the moment interpreter who then interprets what was conveyed, and we try to convey items in simple terms. Sepsis can be sometimes challenging to describe, but we will mention the most common types of infections, and sometimes it's just an awareness of what the symptoms are so that they can get diagnosed quickly so they can be treated in hopes of preventing a vicious cascade. From an infection prevention standpoint, we mention some of the items that we mentioned before, and we'll relay it in different ways. You have to be culturally aware um, that perhaps sometimes the diet of the people that we serve, it could be certain kinds of foods, but we shouldn't we should pay attention to food safety as infection prevention. So in other words, we wouldn't want to mix chicken that is raw with other foods. We need to clean surfaces and so forth. And sometimes we will collaborate with other people to be able to provide services that also address infection prevention in different ways, in ways that you can't see at first, but there is a burden of disease of heart disease, high blood pressure, and those could be risk factors for potentially if they're uncontrolled, if you're more susceptible to infections, are they risk factors for acquiring certain infections? And so we need to prevent those from occurring in the first place. So in some cases, we'll partner with other people to check a blood pressure, check a blood glucose. And for people that have never had those services before, like, oh, this is, you're providing this for free? Like, what's the catch? Um, and and so sometimes it takes going to where people are, because if you didn't go there in the first place, you wouldn't know that they don't know of what is important to do. And when you think of COVID, for instance, there are many, many different um, uh, um risk factors for acquiring COVID that sometimes we don't think about, such as if there's chronic heart disease, liver disease, kidney disease, disabilities, neurological medical issues, and more, such as endocrine issues like diabetes, high blood pressure. These are risk factors. And so, if we can have a better control of what are called NCDs or non communicable diseases, then maybe we can get a better handle. So, everything is kind of in conjunction. In other words, when I put up my infectious disease hat, I really need to put up my internal medicine hat to understand the complexities of the people that we are trying to talk to, and we talk to them in a manner which the information is conveyed hopefully in ways that they can see. Sometimes it's a little bit difficult in a space constraints, and so we are sure to provide an interpreter if we do not speak that particular language. We also need to make sure we're conveying the same kinds of information to clinicians or budding clinicians and more, let alone also to nursing staff and more.
See, and it seems that infection prevention is so strongly tied in with NCDs, with other diseases. And I think last I remember looking for an article I was writing on CDC's website, they had 129 million in America having at least one chronic condition. And that could be diabetes, or they're a cancer patient, or, which are all risk factors, cancer patients, especially because of the chemotherapy and the immunosuppression, they're all at risk to develop an infection. So they're really strongly tied in.
Absolutely. And, I would have to also say that I think that there are likely people out in the community that don't actually know that they're immunosuppressed by virtue of the medications they're on and more, because we can assume that people probably know if they have chemotherapy and more, but there are sometimes other classes of medications that people don't necessarily understand that they're immunosuppressants. And what is the true burden of people who are immunosuppressed? It's probably more than what is estimated. And so there is so much to do to educate people about their risk for infection so they can be proactive. um, this is not really a good corollary, but all of us know probably someone who's had cancer, and we always want to think, oh, what could we have done differently to prevent this? And sometimes there's absolutely nothing. Imagine if you knew all the tools to try to prevent infection. We know some of those tools actually, and so I think of it sometimes in those ways, even though it's sometimes unfair, because I want to try to prevent certain things from happening in the first place. Once they do happen, then we need to try to properly diagnose and treat and work with somebody, because you can sometimes have recovered from sepsis or even septic shock like yourself, but there are always the potential for physical, mental, and more kinds of after effects. And that is not as commonly known to the public or to others who have been through this. Um, and it's just devastating.
I think the education, but when you mention the medications, especially in my case, I was on prednisone, and I was off on doses, high doses of 40 milligrams sometimes a day. And my doctor said, just be careful not to get sick. I'm saying don't get sick is one thing. I thought they meant a cold. Had no idea. Had no idea what could be coming for me, which was, the infection, the diverticulitis, the infection, and the septic shock. And so even then, even back then, I did not fully understand the medications I was on and how that could correlate into something very bad. Now, that doesn't mean I was going to say, well, I'm going to stop taking the prednisone, because you can't do that either. But But if I had been forewarned to be more vigilant for something serious, I think that could have, because I'd never heard of sepsis until it almost killed me. So I didn't know it existed. And I didn't know that I didn't even understand that an infection could be as bad as what I had.
Yeah, I'm you're a survivor to have survived septic shock, let alone many of the other things you've openly discussed about. But I think that there's this sweet spot because so often we hear about people who now know of sepsis because they went through it or someone that their one of their loved ones did. But there's this sweet spot when people are healthy and where they may not want to listen to educational lectures about preventing infection or what sepsis is because they're fine.
Yeah.
But it's exactly that sweet spot that we want to hope that you're continue to be fine, and to keep up to date with information about preventing infection and even the signs and symptoms of certain kinds of infections. I mean, after all, who hears about diverticulitis when you're healthy? No one, right? And so there's this there's this I feel like there could be a sweet spot, but it's also a vulnerable spot because you won't have as much interest, unfortunately, many times until someone is personally affected or impacted by someone that they know, and somehow we have to turn that sweet spot over so that of course it's not just about education and so forth, but that is like kind of the baseline that we need to try to achieve.
Yes. It's like when I had the education booth at the In the Streets Festival a couple of weeks ago here in Frederick. And no, I didn't have the most pleasant topic to talk about, but people did stop by to learn about sepsis. Well, they saw the Sepsis Jeopardy game that I created. So everybody wants to play a game, right? And they would come over, and I'd say we saw more than 100 people that day at the booth. I talked to more than, I actually went hoarse by the end of the day. I couldn't talk anymore. But people came up. Some had been affected by sepsis. We had one who was an amputee. She had lost her arm to sepsis. And then we had others who, I'd say, do you know about sepsis? No, I don't. What's this game all about? And can you tell me about it? And they would look in, I had a copy of my Washington Post story up there, and they were reading that and the Sepsis Alliance information. And I said, I found myself saying over and over that day, I said, well, you all know about cancer, right? Even though you may not have had cancer yourself or had anyone in your family affected by cancer, and you know what heart attacks are and the symptoms of that and stroke. We have to get sepsis there too, because even healthy people know what a heart attack is. Even healthy people know about cancer, and healthy people know about stroke. And I think you're right. We have to find that sweet spot so that healthy people as well know about sepsis.
Mm.
Because what is it, like 1 in 3 eventually get affected by sepsis, or is it one in 3 or 1 in 5?
I'm sorry, I don't know the exact ratios, but we do know that 350,000 people die of sepsis each year in the United States, and approximately 70,000 of those die in a hospice setting. And as you're saying this, I don't mean to laugh, but I was just kind of thinking ahead and thinking of, oh, what's the next journal article for you?
Yes.
And it is like, what is the sweet spot that you're right? People know about cancer, they know about stroke, heart attacks, and more. But where is the spot for sepsis? And in a good way, Sepsis Alliance produces a survey every year, and we know that the knowledge of sepsis has increased. Um,
Yes.
there will always be pockets of people, and that's why what is perceived as something as benign as tabling, such as what you did the other day, but you jazzed it up with some sepsis jeopardy. Freebies always help, but it's kind of
Yes.
like this mano a mano, like street fight to get to every nook and cranny. Whether you're in a rural location or an urban setting, whether you're in um, different counties or areas, whether you're in the US or globally. And that's why it's important to establish relations, partnerships, and more, because this isn't just an individual fight, though it has become one that is probably going to be one of your lifelong passions, but it's something that we need to convince other people about the merits. And just imagine if they said, "Oh, I knew a little bit more, so I knew how to go early." And those are the good and the sad stories, right? Because if they've had sepsis before and then they knew to present earlier, that's good and then it's bad, right? Because they had sepsis before, so then it's kind of here again and so forth. But at least they know to present early so they can kind of catch things early. And in fact, those are sort of the interesting tidbits I like to get when I speak to people who've had infections before. And I actually kind of like it when they say, "I knew what to do this time." And because to me that's a victory. And it's sad that they had an infection again, but it's a victory that they knew what to do. And it's also important to train people to know what to say, to convey that this is serious, that they need to be evaluated, and more. And um, there are many ways to go about this, but we need kind of everyone or more people um, that are maybe your mentees in the future or something. But
We need
um,
like little foot soldiers to
oh
go out
yes,
within our communities,
oh
especially our
that's
rural
interesting.
communities, and inform people. I did give a presentation last year in West Virginia, and they were very grateful. These were like caregivers and people who went and did home health care, and they were very interested in this topic and getting the information out. It like ripples in a pond. I tell them, and then each of them tells five other people that they know.
You raise a really good point, and actually, I believe there is a interest in rural health across the nation, and perhaps sometimes even in listening sessions for what states who are competing for those rural dollars might want to focus on. And at the end of the day, sometimes it gets to old school folks that are like other folks and who can convey the information. And we cannot underestimate the caliber and might of CHWs or community health workers, because they are kind of embedded in their own communities. They already have the trust of their communities. They can speak in a fashion and manner that they're respected. And imagine if you had kind of like a public health service corps, but for sepsis and infection prevention across the nation. Perhaps it's embedded in other jobs, whether somebody is they're in like some kind of community health work academy or something, and then you get to teach them, and then they potentially can convey it to other folks. There's so many ideas. It's almost as if you could come up with an event and kind of one of these innovation days of like, what can we do realistically with what we got, and be able to share the collective knowledge, experiences, and lived experiences of people, so that this either doesn't happen or is kind of blunted when something like this happens to you or someone that you love.
Well, Dr. Ho, we certainly have a lot of work to do. There's there's a lot to do out there, but it's also exciting because, as you said, according to Sepsis Alliance surveys, more and more people are becoming aware of sepsis. And I believe we are going to get there one day where people know what cancer is, they know what sepsis is, heart attack. Because again, back to what you said about, these diseases, they are tied in with infection and possibly sepsis. So it's all related in some way. Um,
Absolutely. Couldn't
yeah.
agree more that there's a lot to do. I think excitement is good. And I think one area that we didn't touch up much upon was the fact that sometimes we need the will of the people and the might of legislation.
Yes.
And Sepsis Alliance is engaged with legislation at a national level, state level, and obtaining sepsis proclamations, which means that at the state level, whether you can gain support from those sites. And I think everything counts, and clearly the collective work of Sepsis Alliance, kind of foot soldiers like yourself and many others, including other sepsis organizations, is really helped to sort of turn the tide, at least as far as knowledge and awareness. Of course, we have more work to do, but it's exciting as far as that we have many ideas because we're not going to give up. And I think it's really important that other people also know that they could become foot soldiers, also, so to speak.
Yes. Yes. Anyone who's experienced sepsis and wants to learn about advocacy, certainly reach out or drop a comment below this episode, and I'll definitely get back to you. I think a nice way to end this as well is I'm always inspired by this sepsis survivor in Australia, Caitlin also, and she posts also a lot on LinkedIn and on social media, and she's very active in advocacy now. And she always says, together we face sepsis, with the big emphasis on together, whether it's from the US standpoint and then branching all the way out to a global perspective and a global togetherness to face this and make sure everyone is included from a cultural standpoint as you are doing. And, hopefully many more doctors and hopefully some in the medical providers will get inspired as well by this episode and reach out to you about this grant and the program that you're working with now.
Well, thank you, Jackie, for allowing me to come on today. It's been a pleasure to speak as Chief Medical Officer for Sepsis Alliance. Encourage everybody again to explore sepsis.org, and also encourage all of you to look at previous podcasts from Jackie and post podcasts, and maybe read a little bit about the articles that she has written before about sepsis, because it takes everyone to help in this effort. So thank you very much, Jackie.
Oh, thank you, Dr. Ho. Again, I was so excited to have you on today and continue to keep doing the wonderful work that you're doing. And I want to thank our audience for listening today. And we'll be back again with another episode in the future. So thanks, Dr. Ho.
Thank you.